All right, folks, here goes nothing. Autism, ADHD, and acetaminophen. Oh boy, this should never have been politicized. So, politics aside, what is the actual evidence here? So, my name is Dr. Erica Crumbeck. I'm a naturopathic physician. I'm the founder and editor of naturopathicpediatrics.com and pro.naturopathicpediatrics.com. I have been discussing the potential dangers of acetaminophen for over 10 years, and now, because it's suddenly politicized, I get to be the crazy lady. So, can I say again, this should not have been politicized, and I am here to just answer some questions that I've had about acetaminophen. And the goal today is just to objectively review the evidence without putting in the politics. So, because of this, we will be heavily moderating the comment section. The comments here should just be asking questions about the evidence, critiquing the evidence, putting in maybe if you feel like other evidence that you feel like is relevant would be great. I'm happy to have that conversation. This is not the place, though, for personal stories, for lashing out based on how we feel. There are other places, both on the internet and preferably in person, to have the conversations about the stories that are really important to us. So I just want to say that because the comments can get really overrun, and I really want to focus on what the evidence says. So, and then I want to say I'm human and I can be wrong. I could be completely wrong. And that, if that's the case, point it out. That's fine. I am happy to change. I'd be happy to change my opinion or my point of view. And today, again, I'm just kind of going over what the evidence says. But that doesn't mean that you get to threaten me. And yeah, that has happened usually for talking about vaccines, because I like to just present what we have. And rather than make it fear-based, just give parents as neutral of information as possible. And that's usually what people kind of appreciate about me, but a lot of people get threatened by that, and that can be, it's just hard. So, okay, so a few things kind of before we get into the evidence here. So I want to say first that neurodivergence and neurodiversity has existed probably throughout human history. Autism isn't new, ADHD isn't new. Secondly, I want to recognize that many in the autistic community are deeply offended by RFK's language about autism or around autism, saying things like, we're going to solve autism, we're going to cure autism, like people need to be cured or solved or prevented for them being who they are. I think this is a way of undermining the experiences of that community, and it can be deeply harmful. So I want to clarify, I want to say that what we are talking about in today's conversation mostly is autism or ADHD that is challenging enough to the patient that it requires intervention. So for example, level 2 or level 3 autism. Kind of like to explain this sort of like, families in my practice, someone might have anxiety, and some people may be born anxious, but that might not interfere with their level of ability to, say, go to school until it does, and then it does need some intervention. So that's what we're talking about here. We're not talking about fixing people for who they are or changing personalities. We're talking about prevention of things where it does require some kind of intervention. So I want to be clear about that. And then let's talk about the incidence of autism a little bit. Many in the community and definitely many in literature claim that the increasing incidence of autism is only due to either new diagnostic criteria, like expanding the diagnostic criteria, or better screening. And this is going to be very unpopular. I think this whole video is going to be really unpopular, so let's just go for it. The data actually does show that level 2 and level 3 autism rates are increasing. So for all of this conversation today, I will be posting all the links below in order of what we're talking about. So population-based surveillance in the US and UK does show an increase in ASD prevalence and incidence. The rates have risen from about 1.1% in 2008 to 2.3% in 2018 among 8-year-olds in the US and similar in the UK. I have, again, that study below. And again, if you look at the study and just the abstract, it's a little bit misleading. It makes it seem like it is just from new ways of collecting data, but actually the increases in incidence are observed from all levels of intellectual ability and support needs, and it's not limited to just milder presentations. There's also some data from the metropolitan Atlanta area that shows that the prevalence of ASD with co-occurring intellectual disability, so basically higher support needs, has increased. So this is not just from increasing recognition or changing diagnostic criteria, but at least some of the evidence strongly suggests that rates are increasing. I know that's not going to be popular. Sorry. So again, you can read those studies below. You will need to go past just the abstract to see that. And then there is another study that discusses changes in diagnostic practices. There's another one that references a Danish study that shows that only about a third of the increase in diagnoses can be explained by broadened diagnostic criteria. So that's another thing. I'm all sorts of unpopular. Okay. Then I want to acknowledge that autism and ADHD are multifactorial disorders. So especially for autism, science has shown that development is influenced by genetics, epigenetics, environmental factors. There is no one single cause of either of these disorders. Please be clear on this. I am not saying that there is one cause. So, with all of that disclaimer said, I want to discuss the data a little bit, because what has not been reported in media, and I feel like has been reported poorly in conservative media and in liberal news media, is just the actual evidence. So this is the new study. Usually I like to put this in a little box, but we just want to have time. I want to release this as soon as possible. This was the study that was released in August, just last month, in the Journal of Environmental Health. I'll put that link below. And the article is the evaluation of the evidence on acetaminophen use and neurodevelopmental disorders using the navigation guide methodology. It included 46 studies, 27 reported positive associations, 9 showed no associations, and 4 showed negative associations. Let me show or quote from the study. Their overall results, and I quote, are a strong and consistent association between prenatal acetaminophen exposure and ADHD, ASD, and other neurodevelopmental disorders. They also evaluated for confounding, because that was a big criticism of the studies in the past, and they still found an association. So let's go over those for a second. To address confounding, they controlled for other factors that may influence acetaminophen use. This has been the biggest consideration, that if someone needs more acetaminophen, maybe they're already predisposed to having their child have autism or ADHD. They did control for this in many of the studies. So that included controlling for maternal age, maternal illness, maternal use of medications other than acetaminophen, maternal intelligence, both parents' education levels, socioeconomic status, maternal drinking, maternal smoking, maternal drug use, genetics or genetic confounders, and then other confounders like taking certain medications. They also adjusted for infant factors, including child birth weight, child gestational age, and then other like control exposure periods before versus after pregnancy, et cetera, et cetera. So the author's conclusion is that the associations still exist even after adjusting for potential confounders. And this is their direct quote. These adjusted results provide strong evidence that the observed relationship was not confounded, but was, in fact, a likely relationship, even though there is, as always, a possibility for residual confounding. So what about the other evidence? So the evidence given by the American Academy of Pediatrics, which is what they are using as their justification to say acetaminophen is definitely safe, is based on a study that was published in JAMA of April of last year. It was a relatively large Swedish study called Acetaminophen Use During Pregnancy and Children's Risk of Autism, ADHD, and Intellectual Disability. So the problem with that study is that reportedly only 7.49% of the children were, quote, exposed to acetaminophen during pregnancy, which is an implausible number of children. So globally, rates of acetaminophen use in pregnancy are closer to 50%. And there's actually other Swedish studies that show rates somewhere between 40 and 55, 60% in pregnancy. The way they collected this data was just as it was basically a review of records. So it was whether or not the maternal, whether or not the mother, which they called birthing person in the report, whether they reported it to the midwife in pregnancy. The midwives did not specifically ask about acetaminophen use. It was just whether it was reported. So there's always a chance that they didn't report. And in fact, that JAMA study even states this in the discussion section, that as the midwives were not specifically asking about acetaminophen use, that is a limitation of that study. I will put that study below as well, because again, maybe I'm wrong, and maybe that study is correct. The discussion in this one, it goes through a discussion of this JAMA study and in the limitations of that study, and using some larger studies that do show a link. And then we go to sibling control studies. Most sibling control studies do not show a link between acetaminophen and autism risk. And however, I do, again, recommend anyone reading this gigantic 42-page study, of which I've read all of it. Most of the sibling studies were pretty small, but not all. And, you know, there was perhaps a chance for confounding in that as well. The discussion in this article said that sibling studies, there's a chance we're actually introducing confounding. We know that birth order alone is going to change the rates of ADHD and autism because the rates change with maternal age. But they were saying that there's actually a risk for introducing bias in sibling studies. So I think that that's something important to note. So there's more evidence. There is, of course, there's actually other meta-analyses that do show a link. Again, there are a few studies that don't show a link. And again, this large study says even when adjusting, there is an association. That's what the study says, for as unpopular as this will be. So let's talk about kind of potential mechanism of action here. And there are many potential mechanisms of action for a possible relationship. We know that acetaminophen does cross the placenta quickly. We know that acetaminophen does convert in the liver to a relatively or very toxic metabolite. It's abbreviated NAPQI because I don't want to go through the non-abbreviated version. It's the same metabolite, intermediary metabolite, that in high doses causes liver failure. Acetaminophen-induced liver toxicity is still the, number 2 maybe, cause of liver failure in either the US or the UK. You have to update those stats for you. But the last I checked, it was either number 1, 2, or 3. So that's known. We know that animal models show that prenatal acetaminophen exposure does increase oxidative stress in the brain of animals. We know that acetaminophen is an endocrine disruptor. That's been documented. We know that acetaminophen reduces glutathione. Just as a reminder, glutathione is the body's main endogenous antioxidant. It's a really important antioxidant that we make. That's what endogenous means. Antioxidants are important for reducing oxidative stress, and we know that glutathione is one of the most important ones that can actually cross the blood-brain barrier. We also know that genes relating to antioxidant and detoxification properties of glutathione have been consistently implicated in autism spectrum disorder, and those include things like glutathione transferases, transsulfuration genes, and glutathione peroxidase genes, and more. I'll put that link down below. We also know that acetaminophen affects the endocannabinoid system. The endocannabinoid system regulates brain function. It actually is involved in social behavior, immune responses, and it does appear to be altered in individuals with autism spectrum disorder. And there was that study that came out, was it 1, 2, 3 years ago? Time is a blur. That shows that acetaminophen exposure in adults can actually cause social and emotional blunting. So that's also concerning. So there's multiple ways that acetaminophen could be implicated in autism. Does it? It's, again, evidence is here for as unpopular as this is. My summary here is I'm really disappointed in the American Academy of Pediatrics and AAFP for saying that acetaminophen is definitely safe. I'm not going to be so bold as to say acetaminophen is definitely unsafe, but I think the evidence is strong enough that we should definitely be cautious. And so, that leads to, this is where I think people are going to be so angry, and this is where I've had people lash out at me before. One, people saying, I took Tylenol once, or I took acetaminophen once. Is my baby going to be autistic? And this is not how this works typically. That acetaminophen is not the one or only cause of every case of ADHD. Of course not. As we've already stated, the development of these conditions is multifactorial. We already know this. We already know that these conditions tend to run in families, and in the majority of families, it is definitely running in the family. So other things that we know for sure are implicated, especially in autism, but also somewhat in ADHD. The strong associations that are well documented in research are advanced parental age, both maternal and paternal, premature birth, perinatal complications, especially hypoxia, maternal obesity, gestational diabetes, maternal immune system activation, that includes infections. We're going to talk about fevers in a second, hypertension, asthma. We know for sure air pollution, especially the fine particulates, exposure to toxic metals, pesticides, phthalates. There's been studies on flame retardants in pregnancy or exposure in early life. Those are well-documented risk factors. There's multiple meta-analyses that show associations between pollutants and risk. Then we need to discuss something important here, and that is that fevers and pregnancy themselves are associated with neurodevelopmental disorders, and that's a very strong association. So at this point in time, it is probably wise to use acetaminophen in pregnancy if a mother has a fever, because the association there is so strong. So again, there's a possibility of a combination of factors, probably including acetaminophen exposure increases the risk, but it is never as simple as one thing that is the direct cause. And again, this study goes through the multiple potential implications here, including they're calling it like a two-factor or a two-step process in being implicated. Okay. So what's my summary here? My summary is I think we should be cautious. Why would you not be cautious based on this research? The study authors here state that they advocate, I quote, cautious, time-limited acetaminophen use under medical guidance, and I strongly agree. We don't need women suffering for lack of pain control. We definitely don't want uncontrolled fevers in pregnancy. And most importantly, we need better and more nuanced language. I think, unfortunately, we saw this in the COVID epidemic when we come out with strong statements in public health one way or another without any room for nuance, especially when patients are saying that their experience differs from what public health is saying. It really erodes trust in public institutions. And lastly, this should not be a political conversation. This is not a political conversation. And unfortunately, now I'm going to be labeled political, which I'm not in any way. And I try to keep out of that. So I guess apologies to whoever I've offended, but let's continue to have this conversation. And again, this video is really just about the evidence that we have for and against acetaminophen. And remember, this is only in pregnancy. This is not relevant to older populations. There was already a comment, I think, on the physicians subreddit about a 70-year-old man who now didn't want to take acetaminophen for pain because he thought he was going to, quote, become autistic. So this is specifically regarding pregnancy and exposure in utero. So if you have questions, feel free to ask them below. Again, keep your hate-filled comments to yourself. There's probably plenty of other places to do that, but at this point in time, we need more nuanced conversations. We need more kind conversations just to, talk about evidence so that we can keep our emotions out of it, because this has become such an emotionally charged topic. As always, take care.